Everybody, this is Dr. Nick here, Dr. Nick Baboulas. I just wanted to show you a little bit about the sensitive imago. So over the next couple of videos, I'm going to be showing you just how the sensitive imago looks in terms of going through the scan, with starting at the start, which is adding in your name and creating a patient file. So we're going to start today with just doing a patient file and choosing symptoms in order to be prepared to scan. So first thing we do is go here and we add in the name. So today we're going to check John Smith. So we put their birth dates, as you can see. So let's just say 1956, and that's fine. We'll put it as male. Then we check their height directly, so 6, and then their weight. So in terms of the more information we give, the better off we are. And then if we know their blood type, we add that in because that can help out in the future. And then we click OK. So here you see that it showcases the human body and it has these little red dots all over different parts of the body. So we click on the dot, and then when we click on the dot, a bunch of symptoms come up. So what our goal is to do is within the last 2 months, we want to know what the top priority symptoms have been. So our goal is to hit approximately 10 symptoms for the whole system. So in this case, we can start with the head and think if we had maybe a low memory, and we'll add that. If there's a little bit of dizziness, we can add that, faintness. And then once we're done with that part, we can go to the next area. So ears, if we think there's ringing, we'll click on that on both sides. And then if there's problems with the eyes, again, we'll see what's happening there. If there's no problem, we move on. Same thing with nose. If there's no problem, to move on. We'll check the throat. Say there's hoarseness with this patient, we'll click that. And then if there's any pain in the shoulders, say example now the left shoulder, we feel like there's pain in that joint, we'll click on that. And then we'll go to the chest organs and heart and see if there's anything there. And then also if we have, say, some dermatitis as an example, and we know that it always comes in the lower margin of the left rib, we can actually move the marker to that area that we know is more pronounced. And then again, we go through the rest of the different areas. So if we feel nauseous or kind of increased appetite or gas, we'll click on that if we think it's in that area. And as you can see sometimes, that once you click it one time, it'll stay there, but also it might be in another area too. So we'll check the abdomen again. Say this person is more constipated overall. And then we'll check the hips. And we'll see, as you can see, there's dermatitis here again, because sometimes there can be dermatitis in this area too. So it stays clicked from the previous one. And same thing with pain in joints. But we would specify it again by unclicking it, clicking it if we felt that there was pain in this area. Same thing there. And then in the pelvic region, we'll see maybe this person has a frequent urination, so we can click that. And then we keep going around to the rest of the markers, seeing if there's anything specific that this patient might have. So again, the arms on the back side, we check if there's anything there. On the neck, again, and if there's pain directly anywhere, we can move this little marker up or down to specify where that pain is. And then lower back, mid back, kind of the kidney regions, and then lower back and the rectum area too, seeing if there's any problems there. We'll click on it. Again, you see constipation is there because we're talking about that specific region. In the back of the leg, if there's anything there. And same with the lower limbs. And then we can push these down if we thought there was, say, coldness in our lower limbs. We can click on that and then bring that down there. So this the second thing after we pick our symptoms is we try to prioritize them. Kind of on a scale of 1 to 10, 10 being the most priority or the most bothersome or the most painful, even if it's constantly on a daily basis, versus those that aren't as intense. So example, if ringing the ears is a background thing, then we'll leave it as it is. But example, if pain in the person's, as we clicked on here, their left shoulder is high priority, then if it's the highest in terms of maybe it's a 9 out of 10 or a 10 out of 10, we'll double click and we'll have this brown will have the letters will change to brown, which showcases a high priority. So the system now understands that's an important symptom that it should pay attention to. Same thing with the low memory. Now, if you think maybe it's say a 6 or a 7 out of 10, we give it a priority by clicking once, and that makes it red. And then we go through the rest of the symptoms overall too, just saying maybe even the dermatitis is a 7 out of 10, then we click on it to give it more priority. Once we do that, we can, if there was any known diagnoses and we wanted to figure out, we can go to a list, for example here, click on diagnosis. If we know, example, this patient had maybe something removed, we'd go down to resections and we say maybe if we have here, we'll check for gallbladder. So maybe this person had their gallbladder removed, we click on that. Now that goes to our diagnosis. Now the system knows that there's no gallbladder in this person, so it takes that into consideration in order to be able to process properly what's going on in that patient. Same time, if we had blood tests or blood results that were done in the last, say, 48 hours, because it's a dynamic system and it quantifies things as it goes along, if it was done within the last 48 hours, these blood tests, we could add those into what's going on in order to get an even more accurate result. However, it's not necessary because the system by itself really has a lot of information once you put in the symptoms and the complaints and previous diagnosis or current diagnosis of what's going on. So then we click OK, comes back to the screen, make sure everything is OK here, and then we put our headphones on the patient and we click OK. So the next video I'm going to show you in terms of how we choose different organs in terms of scanning. So stay tuned for that one.